Hi, my name is Stacy Pitts, and I'm the co-founder of CBD BioCare. And joining me today is Dr. Frank Michalski, who is a chiropractor in Buffalo, New York, and he's also an expert in functional medicine, also an expert in CBD, and especially CBD BioCare. So, hi, Dr. Frank.
Good morning, Stacy. How are you?
Good.
Good.
So we're going to be talking about a very special topic today that affects just millions of people. And today's interview has a focus on our veterans, we are so grateful for, and we offer actually a special coupon for our veterans because we want to honor them, especially this time of year as we get to celebrate Memorial Day. And so we want to focus on stress, anxiety, and PTSD because we know many of our veterans suffer from all or one of those conditions. So let's start by identifying what they are, how they can be treated, and what your professional experience is, Dr. Frank, and then of course how we can incorporate CBD into their lives to hopefully help. So let's start with anxiety. What is anxiety?
Yeah, that's a great question. So what I'd like to say is what we'll be talking about today is we'll use the term anxiety, and I know we're going to go into details about PTSD, but this seminar can really apply to any of the terms that fall under anxiety. So PTSD, certain phobias, generalized anxiety disorder, social anxiety disorder, OCD would even be classified into this category for people. So just for our viewers listening, if you have dealt with any of those in the past, this applies to you. So we'll start right off the bat by just defining stress, okay? Everyone has stress day to day. You go into work, it's a Monday morning, the phone is ringing, maybe your boss isn't too thrilled about something, the kids need to get on the bus. That's stress. That stress will eventually pass, right? You get some emails answered, your boss is happy, the kids got on the bus safely, and that passes. The day goes on and you feel better about things. Anxiety is when we have fears about something stored in our brain that commonly keep reoccurring. So just a brief anatomy lesson. In your brain, you have an area called the hippocampus. And this is an area of the brain that stores memories, good memories and bad memories. People who suffer from anxiety, most of the literature would imply, is that they have an issue of digging up or pulling out these bad memories in certain circumstances. So let's take someone who's at work and their boss is really upset with them, and this has been a reoccurring thing every Monday morning for the last year. Each time they come in, they've had problems. This is going to dig up some of these fears from this area in the brain, this hippocampus, and this is going to result in anxiety. Now, when we have true anxiety, something happens once this area of the brain becomes activated. Your body releases either large amounts or tiny amounts of hormones called adrenaline and norepinephrine. These are the hormones that we've thought about in the past. So let's look back at our ancestors. When you were being chased by a tiger in the wild or something like that, right? Your body would release adrenaline so you could get away from this circumstance. Now, the problem is people who suffer from anxiety, they'll dig up some of these bad memories, either unconsciously or consciously, and the body's going to think they're in danger, that they're in trouble. So it gives them a little hit of adrenaline or norepinephrine. And this is where we start to get that fight or flight response. Anyone who's ever suffered from anxiety, I believe, would know exactly what I'm talking about. All of a sudden, you could be sitting in a room and maybe nothing's bothering you, and then you feel like you're in danger. Your heart rate speeds up. Your breath becomes shallow. Your blood pressure begins to elevate. This is all because of that little release of hormone, norepinephrine and adrenaline. And this is really what causes many of the symptoms related to anxiety that we see day to day in most individuals. So that's one way to define anxiety. Now, that can be acute or it can be chronic. One of the things that I believe goes overlooked is those people who face chronic low levels of anxiety. So let's say maybe we have someone in a really bad relationship, either verbally or physically abusive. Perhaps they are in a very dangerous, a very volatile work environment. Over time, this person's going to build up these fears, and these fears are going to be stored in that hippocampus area of the brain. They're going to be exposed to this chronic stress over and over and over again. When you're exposed to stress, your body releases another hormone, especially when it's chronic. And that hormone is called cortisol. You have your adrenal glands, which sit on top of your kidneys. And every time you're stressed, your adrenal glands release cortisol. Well, initially, a cortisol release can be a good thing. It helps you manage stress. But you don't have an unlimited amount of cortisol. So when you're exposed to low levels of chronic stress over and over and over, your cortisol levels start to deplete. Eventually, your adrenal glands burn out and they say, listen, you're stressed every day. We can't keep up with this. You now get low cortisol levels, which can lead to a whole host of other problems that commonly accompany people who suffer from anxiety disorders. Increased body fat percentages, weakened immune response, increased blood pressure. All these things tie back to that anatomy of lowered cortisol. So really, when we look at anxiety, it's something that tends to happen over and over again. It's because of fears or traumatic events that we have stored far away in our brain that for one reason or another tend to resurface from time to time. And then we see these actual physiological changes, releases of cortisol, releases of adrenaline. It's not something that you just go home and get over.
I have a question.
Of
So
course.
I was under the impression that stress and anxiety cause cortisol levels to increase, not decrease.
And you're absolutely correct. So initially, your body becomes stressed and we get an elevation in cortisol. And that would be for that acute anxiety attack. But now, let's say we've had an individual who's been in perhaps an abusive relationship for 20 plus years, or perhaps they've put their body under a lot of physiological stress. Over time, cortisol's eventually going to deplete, and you're going to see similar symptoms in this individual, but for a different reason. Instead of having that elevated cortisol, they're going to have completely diminished cortisol levels. Having an initial increase in cortisol can actually be a very beneficial thing for our survival, but when it's constantly on high octane, when you're constantly demanding that from your body, it's going to decrease. Imagine running your car in red line all day long. Eventually, you're going to burn out the engine, you're going to chew up the gas and the oil, and your car is going to break. Think of it that way. Maybe at first it's good. You want to speed away from something, you got to change lanes. But imagine leaving your car in that red line position all day long. That's lowered cortisol levels, and that's one of the things that they see in people who have suffered from chronic anxiety. We see this in our patients when we test cortisol all the time. It's a pretty standard test we run for patients who are suffering from chronic anxiety disorders.
Do you find that you have a lot of people that are either currently in the military or have been in the military that suffer from the type of anxiety that you're talking about?
So absolutely. And that would go a little bit into PTSD. And let me give you some of I can even tell you some of the statistics on PTSD. I just want to look at them right here so I make sure I get the right ones for you. One moment. Oops, lost my page. Okay. So 3 to 5% of the general population is going to suffer from PTSD. Now, I tell people this is something we see in our offices from car accidents. People think of PTSD and I think they jump to it. It has to be someone in the military. It doesn't have to. We see this all the time, car accidents, abusive relationships. Maybe we've seen it from people who have been in a very negative, hostile work environment. Those things can create PTSD. Now, specifically for the military, it's 24% right now is the statistic provided of veterans report having PTSD symptoms. Now, this is a statistic that we see clinically, and I think that it is even scarier. Of that 80% of that 24% of people that have PTSD have other symptoms. They have addiction factors. They have depression. They have other immune system diseases. So not only do 24% of our veterans currently suffer with PTSD-like symptoms, and I would guess that number is probably even higher, 80% of them are going to have a whole other host of complicating factors because of that PTSD. So that's our veterans. Now, going back to, and I want to give you the statistics on this, when it comes to anxiety disorders, 19.1% of US adults have reported an anxiety attack over the last year. That equates out to about 3+ million adults a year are coming and being diagnosed with anxiety. This is fascinating. 23.4% of those individuals are females. I just think it's a weird link. We talked about women's health in the past 2 weeks. We talked about autoimmune diseases. Females were 50% more. It was the most common complaint that females were calling into the health lines for, asking about. We always see a strong correlation between autoimmune disease and anxiety. Only 14.3% of males will report anxiety. At the age of 60, anxiety seems to decline. I don't know if at that point you've just been through a lot in life, so it goes down, or what that statistic is. And then this is the most alarming statistic, I believe. And they actually did a special on it this morning on the Today Show about younger people. This is probably an area that's in much need of help, as the veterans are. 31.9% of adolescents are reporting anxiety disorders. 38% of them are younger females. We know there's a lot more pressure on females when it comes to body image, when it comes to social media. So I think it's obvious why that's the case, but I do feel that there's a huge lack of attention being brought to our younger population, because this anxiety is starting young, below the age of 18, and then they're suffering with this throughout their late 20s, 30s, into adulthood. Some other things too, of all those statistics, 22% of those people are going to suffer from a serious anxiety condition. They can't go outside. They can't go to work. They can't complete their day-to-day tasks. Anyone who suffered from anxiety, and when we think about this in the bigger picture, they'll know it can impact your relationships. It can impact your work ethic. It can impact your energy levels. Too afraid to get out of bed. Then you become depressed because you didn't get to work that day because you were too anxious. It's a vicious cycle that a lot of people suffer from.
So I think you've done a good job really explaining when it's stress, when it's anxiety. And, I think we should talk about the levels of anxiety. We have some people who just might have a stressful situation in their life or something that makes them anxious. And then we have something more chronic. Now, am I correct that there's anxiety disorders, and then there's something there's also PTSD, which seems to stem from an event? And I don't know if anxiety always stems from an event. So let's make sure we're really clear on the different levels of anxiety, and then when if it ever becomes PTSD, or let's make sure we really differentiate the two.
Yes, so you have, and I'll be careful on this too, because I'd say I'm sure there's a psychologist who could give a much more detailed answer. But in general, when you're looking at anxiety, it's usually categorized as serious, mild, or moderate. Okay, mild, moderate, or serious levels of anxiety. Mild and moderate levels of anxiety, these people can go to work. They can get through their day-to-day tasks. They may or may not need medication. It's when we jump into that moderate to serious levels of anxiety, these are the people that are really, truly impacted. They can't work. They need heavy amounts of medication in order to just function day to day. Now, you did ask, we kind of touched on earlier. So anxiety, the belief is that it stems from some degree of a fear. So I do believe, and I could be corrected on this, but from my understanding and what it's always been is that there was an event or something put in that person's mind that they go back to and they're digging up a fear. So maybe they've lost a job before and now they're in a new job, and maybe the boss called them into a meeting and they hate meetings. Well, if they think back to 10 years ago, maybe they had a similar situation and they got fired. They might have forgot about that situation, but their brain didn't forget. So in PTSD, we mentioned that hippocampus area of the brain. So in PTSD, in a normal situation, there's a traumatic event, whether it's physical or verbal, or maybe you witnessed a horrific car accident. They did big studies on this with the World Trade Center victims and survivors, right, and their levels of PTSD. So there is usually for PTSD a solid event that occurred. Now, normally in a person's brain, the brain would take that event And over time, it would actually erase that event. It would eliminate that event from occurring. In people with PTSD, that's not the case. That event is always there and it's not really going away. And let's say mild to moderate anxiety, that fear is there, but it goes away sometimes. Maybe it's once or twice a week. And people with PTSD, that fear is always there. The brain failed to eliminate that memory, or to an extent, even subdue that memory. And people with PTSD, I'm going to put it out there and say probably on every level, and I don't think anyone with it would disagree. It affects people physically, it affects people emotionally, and then I think you could certainly find sources that would say too, maybe even on a more spiritual level, right? People tend to become disconnected from other people when they have PTSD. They tend to become disconnected from events and social outings. It becomes a huge problem. So there is a difference. PTSD, there's been a complete failure of the brain to eliminate that memory. It's been engraved in that individual. When we talk about our war veterans, and if you think about the physiology of anxiety, again, you get anxious and your body releases adrenaline. This is a great thing if you're in a combat situation. You need adrenaline. You need a hyperactive response. You need to think fast. Now, the problem in PTSD is you could be sitting at work responding to an email, and your body's going to say, okay, it's go time. It's going to go back to this scary event, this tragic event. And then we're going to deal with increased blood pressure, increased heart rate, inability to focus, a hyper state of arousal. So that's really PTSD.
And I want to make sure people are clear that PTSD stands for post-traumatic stress disorder. So we're actually classifying it as after a traumatic event, there is a disorder that occurs. And so I think you've explained it very well. And the other thing I want to talk about is how much of it can we control? So there's stress, there's anxiety, and PTSD. We're kind of lumping them all together and talking about the levels of severity from a mild case to a moderate to severe case. So when is it something that we can control, and when is it something we need to seek help for?
So that's a great question. So let me start with PTSD on that question, okay? So when someone has PTSD, and even anxiety to an extent, especially if we fall in that moderate to serious range, I always recommend people seek counsel for it. Whether it's therapy, yoga, meditation, whatever it is, don't try and go about this on your own, especially if it's been a long time that you've been suffering from it, because changes have occurred in your brain physiologically. So it's not as simple as, and a lot of people fail to understand this, oh, why is that person so anxious? They're being dramatic, right? They should be able to go out to dinner tonight. It's not that person anymore. The levels of epinephrine and adrenaline and serotonin, there's been chemical changes in their brain. And I'll kind of answer that question by talking about PTSD and explaining why it's out of control for many individuals. So there's three primary areas in the brain that are impacted. First and foremost, your amygdala is an area of the brain. And this is the area of the brain that controls fear. So your response to a situation and fear results. When this area of the brain has become out of control due to PTSD, you have an irrational fear response. So to a loud noise, to a person creeping up behind you. And that makes sense for someone who was obviously in traumatic events and more. The next area, and this one I find to be the most fascinating, I think so important, is your prefrontal cortex. So this is the area of the brain, I've talked about it before, I think when we discussed sleep and inflammation and alcohol. This is the area of the brain that's responsible for making decisions. So we find people who have PTSD have decreased prefrontal cortex activity. This decreases their ability to make decisions. Now, let's take some other things into consideration. Someone with PTSD, we said 80% of those people have other problems, one of which tends to be alcohol abuse, nicotine abuse, and substance abuse. Something I speak about a lot onto is our war veterans and believe it or not, just caffeine and stimulants and those substances. Over time, alcohol, nicotine, high levels of caffeine, the Monsters and the Red Bulls that our military are supplied with on a regular basis, these things are also going to decrease prefrontal cortex function, so that rational decision-making center in the brain. Now, we're going to jump to fear because our amygdala is misfiring. Prefrontal cortex dysfunction, so our ability to make rational decisions is now decreasing. And then last but not least, we see decreased volume in the hippocampus of people who suffer from PTSD. So again, those memories, those fearful memories, are very easily dug up in circumstances where they're really not appropriate. So anyone who's suffering from PTSD, for those reasons, it's not that you can't handle it on your own. You shouldn't try to. Physiological changes have happened. Seek help for it. I would say day-to-day stress, people should try and handle on their own. If they're finding, though, that it's interrupting with their social life, if it's interrupting with their relationship, we hear this all the time when it comes to marriages. If it's interrupting in their parenting, if it's interrupting in their ability to work, if they feel that their energy is depleted because they're anxious all the time, one should absolutely go seek help in those circumstances. And I would argue too, if you have children and you're listening to this and your children have been suffering with anxiety, now is the time to address it, because as they grow up, it's going to become chronic, and that could lead to a whole world of problems down the line.
I think, this is such a big topic, and we could really drive down and really talk about each topic on its own and all the issues that it can cause in people's lives, depending on the level of that they suffer. I do have a little bit of an experience in this area. There was many years ago, I had an incident in my life that was kind of ongoing stress. And what I didn't realize is I was having some physical reactions. So I went to a doctor, and they started asking me questions to find out if I have stress or anxiety in my life. And I thought, what are you talking about? Like, he was checking my heart and things like that. And I honestly thought the doctor had lost it, because I was not acknowledging that I had this stress that was there. It had been a period of time that I was dealing with this, but I felt like I was managing it. But my body, so I was stuffing it and just going through life. And I had a young child at the time, so I had to survive life, right? But my body was reacting to the stress that I was not acknowledging. So I thought that was really interesting. Many years later, literally, I had dismissed this physician completely. Yeah. Many years later, as I learned more, I thought, wow, that doctor was actually right on, and I wasn't acknowledging it at the time. So I think it's just, that's just my little experience. I've never suffered from PTSD or something more severe, but I think it's just such a huge topic, and our body will respond to stress, anxiety, PTSD. And I think it's great that you mentioned that in your functional medicine practice, the fact that you're helping people through that, and how it's really a holistic approach, right? So let's talk about that a little bit, on how, of course, there's other ways that you can take care of yourself. We are definitely recommending people seek professional help if they can relate to what you are saying in terms of how it's affecting their life. But what are some things people can do to help manage, especially if it's on the lower level, to where they can make some different decisions to impact the outcome?
Yeah, absolutely. I'll talk about that. And Stacey, I just wanted to say, I think that story that you told is so important, because that's a prime example of exactly what I was talking about. You said you had a kid, you had a few things going on, and all of a sudden here you are at the doctor for whatever symptoms you had that brought you into that situation. All too often I see patients come in, they'll have GI issues, and they'll have the rapid heart rate, numbness and tingling, a very common result of chronic anxiety in the hands and the feet. And these patients refuse, or have never been informed to acknowledge, hey, is this due to an anxiety? Is this due to another event? All the time in GI issues, when people look at me like I'm nuts, when we say, look, go do yoga, go do meditation, go do something else, you've seen every GI specialist out there. They've told you over and over again, nothing is wrong with your GI system. You've had every scan, every image, but you're sitting here telling me you're going through a horrible divorce. Your child is sick. Your stomach's never going to get better. You can eliminate carbs and dairy and gluten and sugar, but if you don't address the stress, as you kind of acknowledged in your situation, that won't fix. So, of course, what are some of the things that people can do to manage that day to day and try and attack that on their own? And I would recommend incorporating these things even if you're under the guidance of a healthcare professional. So I find some of the big ones, and you can read about this at the Department of Veterans Affairs. I know right here locally in Buffalo, they're offering yoga classes to the veterans. That's one of my favorite things. It's almost like a moving meditation. There's a million apps out there now for meditation. You can do a free trial of the Headspace app. That's an excellent app. I'll put other links in our blog posts too when we discuss this. Exercise, just whether it's weight training or going for a walk, can be a great thing. I do see a lot of patients who come in who have suffered from chronic anxiety, and they've been told, oh, you need to eat healthier, you need to exercise, and that's great. You absolutely want to. But I do tell a lot of these patients, I don't want you doing anything extreme. Because if you go run into the gym for 2 hours a day and you're just trying to work out that anxiety and you're not actually dealing with it, you're going to decrease your cortisol levels more and you're going to feel even worse. So exercise might just be a walk around the neighborhood to start, especially for our chronic cases. You can also, of course, look into talk therapy. That's an excellent therapy. There's different, I forget the name of the techniques off the top of my head, but there's different techniques you can learn in therapy to cope with high anxiety inducing situations. Very simple ones. There's ones as simple as where you just train yourself to watch your finger go back and forth with your eyes. That's one that's very commonly used, and it's amazing how that simple technique confuses your brain and distracts it from thinking of an anxiety-fulfilled event. And of course, we talk about nutrition all the time in our offices. We do want to see people get food testing. Are they allergic to glutens? Are they allergic to dairies? Are there foods that they're eating that could potentially be fueling the anxiety? Remember, there's a very strong, and we should do an episode on GI health, but that gut-brain connection, it does exist. I'll say this, when we look at people with PTSD especially, when we look at people with chronic anxiety, there's a misfiring in their neurotransmitters. About 80% of the neurotransmitters in your brain are also found in your gut. So we want to address gut health. We want to address healthy bacteria levels. There's strong links now between gut health, anxiety, and depression. So nutrition, exercise, whether it's moderate or more strenuous, just depends on the individual. We always recommend some type of talk therapy. And then, of course, as we're probably going to dive into next, supplementation and CBD.
Yes, of course, our favorite topic, right? I mean, everything that we talk about leads us down the CBD path because that's what we do and that's what we believe in so much. And but I think it's really important that we let people know that CBD is a component of good health. So let's talk about how you have seen CBD with people in all three areas that we've discussed: for stress, anxiety, and of course, PTSD.
Yeah, of course. So we'll talk about it for anxiety first. And I'll say similar to you, and I think most of our viewers listening to this are in one way or a percentage, are going to say, oh my gosh, I'm using CBD oil because it helped with anxiety. I can tell you when I opened up a practice years ago, that was an anxious time. I was coming off of chronic stress from school and just other things going on in life, right? Health issues, all types of stuff. When I began using CBD oil, I could not believe the results. There was points where, and I actually didn't know it was anxiety, similar to yourself. I went to see a physician because I thought I had a issue breathing at night. I thought it was allergies or something else. And they told me, they were like, you're having a different type of panic attack. They were like, this is a panic attack. It's not what one would typically think of. I'd lay down at night and I just feel like I couldn't breathe. And it was the weirdest thing in the world. After utilizing CBD oil, that went away. That was an amazing thing for me. I was fortunate it worked so well. Now, the question becomes, how does CBD oil impact anxiety and what is actually happening in the brain and physiologically that's making these changes? So we mentioned earlier that the hippocampus is the storage area for these memories in the brain, right? And people who have anxiety dig up these bad memories consciously or subconsciously, and that induces anxiety. Well, the hippocampus, I want to make sure I say this correctly, so excuse me for referencing, but it has both CB1 and CB2 receptors. So when you're in an anxious event, what occurs is there has to be something that brings your hippocampus to, they call it an excitatory threshold, okay? So for a person who doesn't suffer from anxiety, they're walking around outside and a car goes speeding by. It's not close to them, it's nowhere near them. And my brain recognizes that and it says, okay, that car was far away. Why are they driving so fast? I don't care. I move on. It doesn't make me anxious. Now, maybe you have a person who was hit by a car and suffers from PTSD or anxiety. A car goes speeding past them. Again, they're well out of the path of the danger, but the car is going fast and they see it. Their hippocampus is going to reach that excitatory threshold much, much, much sooner than when my brain did. So my brain doesn't get excited by the car going fast. Their brain says, oh my gosh, I'm in danger. I'm going to get run over again. I have to get out of here. So there's a misfiring in the brain. They're connecting that misfiring now to the CB1 and CB2 receptors in the hippocampus. Something CBD oil does is it binds to the CB2 receptors and it decreases that excitatory threshold. So in theory, the speeding car goes by again, and the person who had suffered from being hit at one point sees that. Now they should be saying to themselves, oh, that made me nervous, but I'm not totally going to freak out. That car is far away from me. It wasn't anywhere near me. I'm going to be okay. The CBD binds to the receptors in that memory area of the brain, and it kind of helps to suppress those bad memories so that part of the brain doesn't get fired up. So that's one of the primary ways that CBD physiologically addresses anxiety. Now, there was 2 other really neat studies, and I'll attach the book that lays these out that were done. And I think this is actually why a lot of professional athletes are in love with CBD products. So they did an experiment with mice, and they put mice in a maze with a snake. They put a snake in the maze with the mice, right? Naturally, the mice were terrified. That's their predator. So as I mentioned, like humans, these mice are going to get a hit of adrenaline, and they're going to have to figure out what to do next. How do we get away from the snake? Now, they gave half of the mice CBD oil prior to this experiment. What they found was the mice who received CBD oil, 2 things happened. They didn't go from a 0 to a 1,000 response, and they also didn't freeze in fear. So some of the mice without CBD oil, and people who suffer from anxiety know this. You go into work one day, you have terrible anxiety, and you do nothing. You're frozen. People, victims of verbal and physical abuse commonly experience this. You can't move. They noticed in these mice, that didn't happen. But at the same time, the mice weren't irrationally acting out. They were going through the maze in a very strategic, thought out manner, as compared to some of the other mice that didn't receive CBD. They either froze or they were so panicked they couldn't pick the correct direction and wound up going the wrong way. When they looked at the scores for each of the mice, they found that the CBD did not negatively impact the decision-making either, which obviously with THC, a lot of people will smoke because they have anxiety or utilize marijuana with THC in it. THC can have the opposite effects. THC can certainly have negative effects on anxiety and decision-making. They also did an experiment with human test subjects. For anyone that's never been in front of a camera, and don't do this if you have terrible anxiety, but if you just have, you've never talked in front of a camera, set up your phone and film yourself talking, and then try and put that online. See how nerve-wracking that is. It's actually a very scary situation for some individuals. So they did a test, and they took people and they said, okay, we're going to have you speak in front of a camera, in front of an audience. And they gave people, I believe it was a dose of around 100 milligrams of CBD. And they actually found that the people who took the CBD had much less of this social anxiety disorder when it came to speaking in front of the camera. They went a step further in this study, and they actually looked at the neuroimaging, so the scans of the brains in these individuals, and they found that areas of the brain that we'll just say light up when there's an anxiety-inducing event didn't light up as much for the individuals who took CBD. Now, I'll make 2 other points, and these ones are particularly important for those suffering from PTSD. CBD, as we've mentioned before, it has a direct effect on serotonin. So when someone's under chronic stress, your body's constantly releasing adrenaline. That's that fight to flight hormone. When you have constant adrenaline being released, that's what crushes cortisol levels over time, okay? When you have crushed cortisol and high adrenaline, serotonin, your feel-good hormones, they don't exist anymore. They've been obliterated. And the receptors that it would normally bind to turn on those feel-good hormones are also pretty much destroyed. So what they found is people utilizing CBD, it binds to serotonin, so turning on that feel-good hormone, and it also appears that it kind of cleans off those receptors. It freshens them up to be more responsive to serotonin. So a lot of people who suffer from anxiety have depression with it. This is a great potential route of exploration for them to go down when it comes to CBD. That would be one of the things that I always like to emphasize to people, its effects on serotonin. That's why I believe we see when people use CBD and they're on anti-anxiety medications or medications for depression, they find that they need to take less of it. I think down the line, research is going to argue, much like it currently is with opioids, that it's not only helping the individual, but it's making those medications much more effective in the long run.
Well, and depression is something that we should take an entire interview time and discuss that, because that's a whole other topic. What we have noticed here at CBD BioCare is we've noticed that people who will say, I'm taking this for pain, and oh, by the way, I've never been happier, or I'm feeling that I'm suffering from less stress, anxiety, depression. There's other factors. We hear that a lot, is somebody's taking it for one thing, and then what they realize is that there's multiple benefits of taking the CBD. Another thing that I wanted to share that we recognize here when people share their stories is that people that are taking CBD for stress and anxiety and PTSD, they can get a lot of success with not a lot of product. So a little bit goes a long way. So if you could talk to how much people should take, especially to start, and a good reference point, regardless of what they're dealing with.
Yeah, of course. And I'll say one other thing about that, because this is a really neat study and it plays right into the dosage for people. They actually did a study involving the endocannabinoid system with World Trade Center survivors back in 2013. This was carried out. I've said this before for a bunch of other conditions. They found that these individuals had decreased levels of blood levels of endocannabinoids, and they're starting to study this now on veterans. So, of course, your logical next thought would be is, oh, what if I take a cannabinoid? Will that help? And the answer is yes. Now, to your point, absolutely. More is not always better. And this is one of those topics where I really like to emphasize that. Last week when we talked about menopause, it would appear that more might be beneficial. When it comes to PTSD, anxiety, especially if someone is having really bad symptoms, you want to start very slow. So I usually start people around 10 milligrams a day, and I don't have anyone where we're above 200 milligrams a day. At that point, we're really approaching cautiously. I would say on average 10 to 100 milligrams a day is probably going to do the trick for people. But remember, it has a biphasic effect. So at the perfect dose, that sweet spot dose of maybe, let's say, 40 milligrams for an individual, they feel great. They might take 60 milligrams and feel more anxious. We've seen this happen. I tell those people, don't fret. If we started at a level that was too high for them, that's great, because you know what? We know it's going to impact you. We know it's having an effect on you. So we simply cut it back for the individual. But 10 milligrams to 100 milligrams, work your way up slowly. I think you mentioned this before. We tell people, especially at nighttime, some people find at too low of a dose, it might keep them up a little bit. Some people find at just the right dose, they sleep like they've never slept before. So really 10 to 100 milligrams, go slow, and I really caution that for people with serious PTSD, people, and you should be working with someone if this is you. You shouldn't just be taking anything on a whim or starting any program on a whim. If you have suicidal tendencies or thoughts, you have to work very cautiously, especially if you're at risk of self-harm, which, this blew my mind. I heard on the Today Show, and it actually made me sick, because this shows how lack of attention we're giving to this. I heard someone say the words, most kids these days are going to have suicidal thoughts, and that's actually fairly expected for a younger individual. how can that just roll off your tongue to say that that's actually fairly expected in today's world? We have I mean, yeah, that's terrible. So really, if you have those tendencies to harm yourself, if you are in danger of other things, if you're suffering with PTSD and the decision making may not be completely rational, work with a professional as you do this.
Yes, absolutely. That's great advice. I appreciate that. I agree. That's doesn't seem like a very wise comment. Um,
No.
I can tell you some of the things that I've heard that I have found really interesting is situational anxiety. Somebody that maybe is anxious to get in the car in the evening or get in the car and drive over a bridge, and people take a little bit of CBD. I had one friend that she said, I never suffered from anxiety. I have no idea why all of a sudden I'm afraid to drive over water. And she said, I had to take my husband to the airport. She said, I was honestly a little embarrassed that all of a sudden I was starting to feel my heart racing. And she was having a miniature anxiety attack because she was thinking of driving over the bridge. And again, she doesn't know why she was feeling this way. And she said, I'm going to take some CBD. And she took some CBD and she never thought about it again. She said, it was the most bizarre thing. I found myself driving over the bridge and seeing the sunrise and focusing on the sunrise and forgetting that I was driving over the water. For her, that was, it was so significant, it completely left her. Now, I'm not guaranteeing that's going to help for everybody, but a little bit for her went a long way, and she had tremendous results. So, CBD is proving time and time again to be a great supplement. And of course, we want it to work for everybody, but your advice, I'm hearing loud and clear, to start low and slow and to seek medical advice, especially if you have a severe case.
Definitely. And I'll throw in two other little tidbits. That driving story, it's fascinating you saying it took me a while to connect two and two together. Eventually I did. I said this in other blogs and stuff, unfortunately I wasn't the world's healthiest person. So there was a point in my life where I had a nicotine addiction. Okay. And I would commonly utilize nicotine in the car while I was driving. If I had a long drive, that was when my body would crave nicotine. And even for months, years after I quit, anytime I'd go past the gas station or I'd be on a long drive, especially in the evening, my heart rate would speed up. And it was because of that craving, that anxiousness. I wanted it to calm me down. There was one night I was driving after using CBD, and I'm driving home, and I remember saying to myself, I was driving back from Canada. I was like, that's going to be a long drive. It's tempting, to pull over, and you want that nicotine. And about halfway through my drive, I was coming back over the Peace Bridge. I live in Buffalo, and I was like, wait a minute. That didn't even cross my mind until this moment. What happened? And I looked into the research on CBD for nicotine cessation, anxiety, and I was like, oh my gosh. So similar to your event, we have patients who will take it before they fly. I'll tell you, I have two people who honestly used to have to take a Xanax. They find they don't anymore. Of course, we encourage they work with their physician. That's not stuff you just want to pull yourself off of. But they had success. And then the last thing I'll say to finish out, and I've hammered this before and I'll hammer it again, when you see people who have PTSD and anxiety, especially now in the younger generation when it comes to nicotine usage and the vaping, when it comes to our war veterans and the addictions that they have to the high-test energy drinks, Red Bull, Monster, Rockstar, and when it comes to alcohol usage. We mentioned this a little bit last week. I said I think there's a big epidemic going on with females and males. We hear it a lot from females. Oh, I have 2, 3, 4 glasses of wine every night. There's a huge problem there. You're trying to cope. You're trying to bury some other fears with nicotine, other substances, stimulants, alcohol. You need to address those issues. It's the CBD can help. And I tell people this is the perfect time to start CBD because it can help with nicotine withdrawal, alcohol withdrawal. There's studies being done on this. Of course, you have to work with a professional. Alcohol withdrawal can kill you, so don't do that on your own. That's one of the main things that can just kill you. But this is a great time to approach life with a different viewpoint and a different standpoint, because if it works for you, some really amazing things might happen.
Well, thank you so much for your advice. And this is a great piece for our veterans, but also for any individual suffering from stress, anxiety, and of course, PTSD. So thank you, Dr. Frank.
Of course, anytime.